Hi everyone, so today I'm going to show you how to prepare a perfect setup for a catheterization IV catheter here at Carrington College. The first thing you're going to need, no matter if you're focusing on soft tissue or dental, is a Mayo stand. Each station gets one Mayo stand per catheter setup. The second thing you're going to need is a catheter tray. These are going to be found over by gauze in the kitchen. The reason why we use these trays is because we like to keep everything organized. You're also going to need your containers for Chlorohex and alcohol, which you're going to use to scrub your patient's skin. Next, we're going to need a bottle of sterile saline. You can see when the bottle was opened. This is important because we only keep these open bottles for 1 month. You're also going to need tape, which I will go over in a little bit. You need a 1 inch and a 1/2 inch tape set. Now these are your IV catheters. This is what IV catheters look like. They have gauges on them that tell you the size. They're also color coordinated. So for the patient that we're going to be placing a catheter on today, she is about 11 pounds. I went ahead and grabbed a 22 gauge, which is pretty standard, and then I grabbed a 20 gauge because you do want to fit the largest possible catheter in the vein. So if we go ahead and prep that site and we see we have a nice juicy vein, then we can go ahead and use a 20. Next, you're going to need your T-connector port. And this is what is going to allow you to induce your patient as well as give IV fluids. We have our flush that I drew up here. We have 3 mils of sterile saline, and these are both labeled sterile saline. That's very important. You always have to have your flush labeled. We also have 2 male adapters. You're always going to want to grab 2 male adapters for cohat land. For soft tissue, you're okay with just 1, but when in doubt, just put 2 down on no matter what tray you're working on. And then lastly, we're going to have our clippers. We use the small clippers for our IV catheter shave prep. There is 1 for soft tissue and 1 for cohat. All right, so in order to complete your tray, you're going to need to prepare your tape first. We always prepare tape at an easy, accessible place so that you can grab it when you are ready to tape in your patient, and I will show you that in the next video.